soon. All of LA County is now lined up on face masks, but in Orange County, where COVID-19 cases are also on the rise, don't expect a return to face masks. A face mask order last year drew howls of protest, and this year, UC Irvine epidemiologist Dr. Andrew Neumer says he doubts a face mask order would work in Orange County because he doesn't think the unvaccinated would follow it. For KPCC, I'm Nick Roman.
California is launching the country's largest statewide universal free lunch program. Officials say when campuses open for the fall term, all public school students will have the option to eat school meals at no cost regardless of the family income. California approved the program last month as it found itself with cash from an unexpected budget surplus. There are 6.2 million school kids in the state. Some U.S. cities, including New York and Boston, have similar programs, but this will be the first statewide initiative. LA Police Chief Michael Moore says he will review body cam footage after an officer shot a protester at close range with a non-lethal round back on Saturday. Cell phone video of a protest in Koreatown over transgender rights appears to show an officer firing a 40-millimeter hard foam projectile at a protester who was just a few feet away. The protester falls to the ground. Chief Moore says it's possible the officer did not intend to shoot the protester, but rather was aiming at someone else in the crowd who may have been attempting to throw something. But he also said,
the officer's actions of using that beanbag involved an individual who did not pose an immediate threat of serious bodily injury, then that officer's use was inappropriate.
The chief says that in the past, when officers have accidentally shot someone with a less than lethal weapon, he has found those actions to be out of policy. Rates of sexually transmitted diseases in California went down during the pandemic, according to new state data, but advocates worry that's just because no one was tracking them. Amy Moy is with a nonprofit called Essential Health Access, and it is sponsoring a bill to require coverage of at-home testing.
The pandemic has really shown us that we need to be making these home tests more widely available and reimbursable under our Medi-Cal program or through private insurance.
Before the pandemic, California's STD rates had been steadily climbing for several years. Experts are predicting a spike with nightlife and other activities returning. Local health departments also have fewer resources to track sexual health. More than 3/4 of local health departments surveyed by the state reported moving at least half their workforce over to COVID-19 last year. Thank you for listening to the LA Report. I'm Suzanne Wadley. Join us again next time. Meantime, get more news at LAist.com and listen live at kpecc.org.
This program is made possible in part by the Corporation for Public Broadcasting, a private corporation funded by the American people.
Some of the country's biggest drug companies are settling thousands of opioid-related lawsuits all at once with a $26 billion settlement. Now, that settlement also includes provisions by which those companies would agree to more rigorous oversight. NPR's addiction correspondent Brian Mann is following this story. Hey, Brian.
Good morning, Noel.
So this is sort of developing as we speak. What did you learn this morning?
Yeah, as you say, the details are still being finalized and sorted out here, but the settlement's expected to involve Johnson & Johnson, as well as 3 big corporations that have served as prescription drug wholesalers, AmerisourceBergen, Cardinal Health, and also McKesson. In a briefing with reporters this morning, Joe Rice with the firm Motley Rice, he's one of the lead attorneys suing Big Pharma over opioids. He described this package as being in the very final stages, and once it's agreed to, it will then go to all of the 50 states. The individual states will have to decide whether this package with $26 billion is enough for them, whether it has enough oversight and safety. So once this thing is inked, Noel, there's a big process of elected officials all over the country looking at this, seeing if it works for their communities.
And then if it does, and $26 billion, these companies pay out $26 billion, where does that money go?
Yeah, so the lion's share, and this is interesting, is committed to opioid treatment and abatement, about $23 billion. So this would be a game changer for a lot of these communities scrambling to fund addiction care at a time when overdose deaths are at record levels. We had more than 93,000 drug fatalities last year, many of them still from opioids.
Yes, and to that end, if this deal is finalized, as I understand it, these companies are going to agree to more oversight and monitoring on opioid medications. How would that work?
Yeah, the people involved in this negotiation will say this was a big priority, and what we've learned is that as opioid addiction grew in the U.S., these big drug distributors just kept shipping tens of millions of pills, flooding neighborhood pharmacies and small towns with pain pills. Under this plan, again, if it's finalized, AmerisourceBergen, Cardinal Health, and McKesson would have to share data, much more data, about opioid shipments, giving a clearer picture of hotspots around the country where opioid prescribing may be growing risky or dangerous.
Okay, now as this is happening, at the same time, New York State's Attorney General Letitia James says she has reached a deal with those three big companies that you mentioned, worth about $1.1 billion. Why is New York doing its own thing separately?
Yeah, so Tish James was on a faster track because she sued these drug distributors and was actually in court here in New York with a trial underway, and that drove faster negotiations. And this New York deal has given us more of a glimpse of what the national settlement will look like. We're seeing these big drug companies will have roughly